Surgeon's view of informed consent.
So I think for me, informed consent really boils down to effective communication. I think, we as surgeons come to the table wanting to convey certain pieces of medical information, and there's a tendency to really feel driven to get this information out. But to me, I think it's more important really fundamentally at the beginning to establish that effective communication and make sure that our patients and families understand what we're saying so the information is received in a way that they can understand. And I think that's in some ways a bit different from aligning expectations, because aligning expectations to me is all about making sure that I am providing what the family and the patient expects to receive, both in terms of what the treatment is and what the expected outcome is. And if our expectations are not aligned, then what I term a success may very well be a failure in the eyes of the patient and the family. So I think they're both very important issues, but need to be thought of in a different way.
Yeah, I would agree. I think that informed consent is much broader, because you really want a family to understand why you're recommending the course of action that you're recommending. And that entails explaining what some of the alternatives may be, and what some of the uncertainties may be, and then why it is that you're choosing the course that you're choosing and what exactly that means. And then I think you get to the aligning of expectations.
I'll confess, when I started this thinking about it, informed consent was all about, it was a legal document. It was about something they needed to sign. It was a process we had to go through with the family and get something signed, and then move on to our surgery. And yeah, I think the whole sort of the light bulb that went off for me was, no, that's a simplistic way of looking at it. And this is it's a process. It's that conversation. It's happening long before you sign the document. And by then, if you haven't established that relationship or transmitted that knowledge, you haven't accomplished your goal. So the nice thing to hear is you guys are already there.
Well, it can take some time to get there. But you're right. I mean, this is the way I think we all begin. We think of it as a simple one-page document that needs to be signed by the surgeon and the patient or the parent. And there's a whole lot more to the process than that. The map.
One of the problems that we heard from families was that they don't know what questions to ask anyway, and so we may be describing it pretty well, and then there's kind of a blank slate and trying to figure out how do you get through that? What do you do?
I think sometimes I find it's useful to prompt them, especially if you feel that they're not asking many questions. I feel that sometimes our role is to almost act as the patient or the family and say, some people often want to know this, or you may be wondering about this. And sometimes I find too, starting very basic level, I mean, people often want to know if this is going to hurt, or some of these things that get down to the human experience, and it helps them realize that, hey, this person who's sitting with me gets it. They get that I'm going to be either having my child or I myself, I'm going to be going through a procedure that is scary, that has some risks, and they appreciate that, and they see me as a person, not just a subject that they're sort of doing this treatment to.
Mm-hmm, mm-hmm. Yeah, I find that sometimes parents will ask a couple of questions, and then they'll say, what other questions should I be asking?
Okay.
And that's helpful because it gives you the freedom to sort of talk about a variety of things and see what they pick up on.